According to the Centers for Disease Control and Prevention, about 1 in 10 Americans have diabetes. Now, those living with the condition know that it can have an impact on their eyes and vision. So that's why we're welcoming Dr. Mansoor Mughal to First Coast Living. And Doctor, you have a very important subject. Diabetes is so common and it does take a toll on its eyes. So what is diabetic eye disease?
Absolutely. Well, it's a pleasure to be here. Unfortunately, diabetes is increasing within the United States in most of the Western world, and this is due to a combination of diet, lack of exercise, partly genetics, but in any case, the burden of disease is increasing in our society, and it definitely does affect the eyes, and there is very good evidence that the sooner we can diagnose and treat diabetic eye disease, the better the visual outcome for patients. So it's so important that any patient that has a diagnosis of diabetes is examined by an eye professional as soon as possible.
Okay, and is this a common thing, unfortunately, here on the First Coast?
Unfortunately so, yes. We see a lot of diabetic eye disease. Unfortunately, within my practice, we've seen a lot of devastating end-stage diabetic eye disease, which presents as retinal detachments, which are extremely difficult to repair. And we want to wind the clock back a little. We want to get to patients, before they get to that end-stage disease. And we have very good, not only diagnostic modalities, but treatment options for patients, the quicker we can get to them.
Okay, and you also have maybe special tools that you use to detect this diabetic eye disease that others don't have. So talk more about that.
Absolutely. We're ideally placed here at Retina Associates. We have the latest equipment. We can detect the disease at a much earlier stage. The basic, simple process that patients will undergo, we check their vision, we check their pupils, we dilate their eyes. We use dilating drops to physically take a look. We can take pictures using cameras at the stage of their eyes and at the stage of the disease. There's a specialized dye test that we can use, and that can actually tell us if there's any areas of retinal damage. And if there's any focal area of damage, then we can potentially treat that locally with a laser. And then our other kind of treatment options, ultimately, we also have an OCT machine for diabetes.
So that's interesting. It's about detecting and then the treatment, and you have the actual tools to help that. And you didn't see that hasn't always been the case. So how does that make you feel as a doctor?
It's wonderful. It's a great time to live in terms of treatment options for diabetic patients. Not too long ago, we didn't have the modern injections that we have that can make such a difference to patients' vision. Once we've actually diagnosed the disease and we've made an individual treatment plan for the patient, we can sit down with the patient, we can show them the areas of disease on their retina, and then we can go ahead and treat either with a combination of laser or with injections within the eye, which are extremely effective. But I'd like to say that the most effective treatment is actually good diabetic control. And to that end, we urge patients to seek care with their primary care provider or their endocrinologist, and we will also work with those fellow professionals to get that diabetic control optimized for the patient, because we have very good evidence that if we can do that, then the eye changes themselves can sometimes take care of themselves.
All right, well, thank you so much for being with us, Dr. Mughal.
It's a pleasure.
Such informative and good information here, and that's, of course, Retina Associates PA. And for us here at First Coast Living, it's an honor to have you, and make sure you check out our website for more on this at firstcoastliving.net.